Hi and welcome back to Pelvic News Channel, the channel for all professionals with an interest in the pelvic region. And today I will discuss research on the Stork test in pregnant women with pelvic girdle pain. The Stork test is also known as the Gillet test. And after watching this film, you will know why the Stork test is not an appropriate test to evaluate trunk, pelvic and hip movement in pregnant women with pelvic girdle pain. And you will also learn some interesting observations regarding movement of the trunk, pelvis and hip in general during the Stork test. In a previous film I discussed research on the difference between the gait pattern in pregnant women with pelvic girdle pain and asymptomatic pregnant and non-pregnant women. And I'll put a link to this film in the description below. The results from that study showed that pregnant women with pelvic girdle pain walk slower, with a shorter step length and with a significantly longer double limb support. And that means that the single leg stance time is shorter. And it was hypothesized that the shorter single leg stance time might be due to a change in load transfer in the lumbo-pelvic hip region. So although it's known that the Stork test is not a good test to assess the mobility of the sacro-iliac joint, this might be different in pregnant population due to anatomical changes and based on the gait analysis. So the aim of this study was to investigate the influence of pelvic girdle pain in the second trimester of pregnancy on trunk, pelvic and hip movement during the Stork test. Women were included if they had a no-risk pregnancy and were less than 27 weeks pregnant. The women were included in the pelvic girdle pain group when they had posterior pelvic pain between the crista iliaca and the gluteal folds, and the onset of pelvic girdle pain was in the current pregnancy. They also had to have a positive posterior pelvic pain provocation test and an active straight leg raising test, the ASLR greater than 0. For the Stork test, the patient is asked to lift one leg up to 90 degrees of flexion of the hip at their own speed. The first 4 tests in which the participants stood on one leg, so the single leg stance, were analyzed. The test site in the women with pelvic girdle pain was the most painful site, and in case pain was equal on both sides, the test site was randomly selected by a coin toss. The test site in the asymptomatic pregnant and non-pregnant women was selected by a coin toss as well. All groups got biomechanical testing with markers on specific anatomical landmarks to measure the trunk, pelvic and hip movement. For the analysis, 25 pregnant women with pelvic girdle pain, 23 asymptomatic pregnant women and 24 healthy controls were evaluated. The results showed that first of all, pregnant women with pelvic girdle pain had 2.1 degrees less hip adduction when compared with asymptomatic pregnant women. This was a significant difference between groups. Secondly, that the difference between women was large within every group. And thirdly, that the 4 repetitions of the Stork test each woman was asked to perform showed small variation within. So the results show very small and few differences between pregnant women with pelvic girdle pain and asymptomatic pregnant women. And therefore it's unlikely that we can detect this very small difference visibly. This research also showed that women in all 3 groups vary greatly in movement pattern. Some women would lift their leg quickly and others more slowly. So if a pregnant woman with pelvic girdle pain lifts her leg slowly, this might not be because of her problem, but just because that's the way she is used to perform this task, pregnant or not. And of course, speed of performing the Stork test might influence trunk, pelvic and hip movement. So the shorter single leg stance time of pregnant women with pelvic girdle pain reported in the gait analysis cannot be explained with the static Stork test. Well, I hope you liked this video and share it with your colleagues. And if you haven't already, consider subscribing to my channel down below. And of course hit the notification bell, and in that way you will get a notification as soon as I upload a new video. Thank you for watching and see you next time. Bye bye!